Thank you for inviting me to this interesting congress, and I would just to mention a structural social determinant which have big consequences on the child health and mental health, which is homelessness. So the epidemiologic context is for child mental health is that there is an increase there is few studies in France, but it increase with age. We talk about anxiety disorder, attention hyperactivity disorder, autism, depression, sleep or eating disorder, and post-traumatic stress disorder. So it's about it take from 2% under 5 years to 20% after 10 years. And the risk factor for depression is exposure to war, terrorism, the pandemics, migration, poverty, violence, and homelessness. So it's just to focus my my slide on homeless children, which represents at least 42,000 children in France actually. And that's mean a lot of children, most of them are in social hostel, and there is no solution due to a lack of available of suitable places. So you see on the slide the evolution of the profile of the homeless people in France, and it means that there is more and more children under 5 years old who are in the street or in shelter in social hostel. And this is in the evolution in the last years, and it's worse now. So we perform with the Observatoire of Services Social of Paris a study about homeless children. So the population was 1,800 families, which is about 10,000 homeless families in Ile-de-France, and most of them are in social hostel. Most of them are migrants families, mostly from sub-Saharan Africa. The living conditions are very worse because 41% case at least one child shared the parent's bed, so there is some sleeping, not optimal sleeping habits. On average, they have a residential instability very high, with 4 moves a year. About half of them were single parents families, and they have on average 2 children by family, and the average age was 5 years old. So first of all, I would like to focus on the mother health, because as you know, it's not independent of the infant one, of course. So the household were in very food insecurity, because only 14 were in food security. That means that more than 43 were with low food security, and near 10% were very low food insecurity. That means a situation where children also affected. So anemia was detected in 49% of the children and half of the mother. So the associated factors were to anemia in a group with under 5 years old, were child food insecurity, of course, but also living conditions due to homelessness, such as no cooking facilities, and of course the household monthly income. So we have some of the published results on the right side of the slide, but I just focus on some of them. And for instance, the mother mental health was also a major issue, with nearly 1/3 with high prevalence of major depression, and near 20% in post-traumatic disorder, mainly due to migration trajectory, but also due to the living condition in the host country. And from the perinatal health, it was also a major issue, because only 1 in 5 has inadequate prenatal care utilization, and the factor associated with this inadequate perinatal care utilization were sociodemographic characteristics. such as young age, premarital youth, which is classical in the previous studies, but also health status and living condition, and mainly the housing instability in the second and the third trimester of pregnancy. So concerning the child health, this living condition has a major impact on the child health, mainly in the child development, because most of the children were considered developmentally delayed in the Vinland assessment, and the factors associated with this delay were age, birth in a country other than France, low birth weight, and past year hospitalization. Regarding to the vaccination status, we found that vaccination coverage in French-born homeless children was very high, which was surprising. That means our system was efficient. But it's not true when you perform the analysis according to the birth regions. So the children who were born outside of France has a vaccination coverage very low, and it's mean under 50% at 2 years old for all the vaccines. The factors significantly associated with this insufficient vaccination coverage were parents with French language difficulties, and also living conditions such as changing residence. So we found again the residential instability. And children in the other hand, the children in contact with the healthcare system has a more significantly higher vaccination coverage. Considering respiratory status on asthma, the prevalence of asthma was about 20%, and the factors associated were related to the poor using condition, and also being born in the European Union. Most of the children with asthma can use the healthcare service, except for them who are living in France for less than 40 months, and those who have having French difficulties. And again, we found the poor housing condition. I mean poor sanitation, including the presence of mice, cold, dampness, the poor quality bedding, lack of space, and overcrowding housing. So now I will focus on mental health. So about 20% of children have a high level of emotional and behavioral difficulties. And it was the SDQ total score were very high from compared to the population in general. So we have also factors associated with higher score were characteristic socio-demographic characteristic as children older age, parents, region of birth, and in particular sub-Saharan Africa, child health problem, overweight, and poor maternal mental health, but also housing conditions such as residential mobility, the child's inadequate sleeping habits, the child's negative perception or his living arrangement, and also the experience of school bullying, which has been present this morning. So this is I don't have time for that, but you have all the factors and the publication. So I just want to summarize the results because we have a lot of fire alarms, so I come back. For the child mental health, we have also the Dominics, which is an interesting tool because it's allowed to the internalized disorder of the child to be more expressed than in the SDQ, for instance. And there is 20% of the children who have a mental health disorder. And the factor associated with higher children's score were parents' irregular administrative status, the child sleeping in the parents' bed, the child having been hospitalized in the last years, and the child being bullied at school. So we find again the structural factor of the discrimination and in the school place. So how homelessness impacts the child's mental health? It affects all the environment in which children evolve. I mean the family environment, the school environment, and the social and friendly environment. So in the family environment, degrade and unsafe material living conditions. That means a lack of stable environment, and in particular residential mobility, which is very high, in particular in the people who are in a migration trajectory, living condition, inability to meet basic needs, sleep, food, and so on, exposure to many dangers, in particular the street and in the accompanying children, and food insecurity and mental health. It could also affect family relationships and functioning, living in cramped conditions. That means tension, violence, lack of privacy. And in the school and social environment, because school is an anchor, because it's a source of resilience when everything is doing right, a place of socializing, and it's essential for the child development, but it also could be a source of difficulties when school refusal based on discriminatory criteria, such as homelessness, the residential instability, which can lead to disruption in school career and school trajectory of the children, learning difficulties, and stigmatization. So in conclusion, children growing up homeless experience high level of psychological and physical difficulties, which can put them at risk for poor mental health and poor physical health and educational outcomes, not only in the short term, but also in the long term in their life. The access to appropriate screening and medical care is really a need for this vulnerable yet underserved group. And how finding highlight the importance of psychosocial determinants and the structural determinants in the child mental health and and underline the need for prevention. Not only in homeless family, but focus on improving the living condition, the schooling, prevention, and the healthcare condition. So in recommendation, we have some difficulties because in France, as I think in other countries, of course, we have insufficient and compartmentalized public policies. So they are in, I don't know the term in English, silo, I think. So they don't have interconnection and intersectorial connection each other. So accommodation is still based on emergency, temporary and short-term measure, but in fact the children live from sometimes 10 years, so it's all the childhood, in fact, and mental health policies still are insufficient, take little account the specificities of the children and the social structural determinant, for instance, homelessness. So we have done an advocacy with the UNICEF, which the report is here to promote mental health for homeless children, ensuring a safe, caring, and stable environment necessary to their development and well-being, improve the prevention and detection of mental health problems, taking into account the specific needs of the homeless children, because in homeless services it's mainly for the men and with addictions and not really adapt for the children's needs, and promote cross-sectional intervention between accommodation, health, mental health, and pediatric sectors. So that report have been advocated by UNICEF at the Parliament in a few weeks ago, and we think it's take part of the to avoid the suppression of the shelter places, which was planned by the government. So thank you.
Thank you, Stephanie, for shining a light on this. I think particularly disadvantaged population of homeless children. Are there any questions from the audience? Yes.
Yeah, thank you for sharing this important work of the really disadvantaged children, the most disadvantaged maybe. I just have one question. When you describe this population, what comes to my mind is the situation of undocumented children in many parts of Europe. So I was wondering, because you didn't say anything about that, if some of these children were also undocumented, so living also with the legal uncertainty and that kind of stress, or if these were families that have residency in France.
So you're right, it's undocumented. It's very difficult to conduct survey on such population. The first reason is that we don't have, for example, in the National Public Health Agency, we don't have we don't have social determinant, in fact, because due to the medical surveillance system, there is some biomedical data, but very few social data, and we can individualize homelessness in the classic surveillance tools. So we have to perform studies, and it was very challenging because we have. I didn't have time, but we have performed the study in 17 languages. And what is very difficult is that we haven't a sampling design. We have a sampling design, but we have not the database for the sampling design. So because the social hostels are not a registry, so we have to spend a few months to know where the family and the children, homeless children, were in the greater area before to conduct the study. So it spent a lot of time, and I think as people haven't got time now, it's very difficult to conduct such studies. So
I just didn't understand. Were they residents or were there undocumented families?
yes, they are here, in here. That means that there was administrative status, in fact. So because we haven't, it's a kind of contour the law, because we haven't the right to mention the undocumented children. So we have only the administrative status, which is irregular, but it means the same. So we have about 50 of them who are undocumented.
Imti Chinara, University of Nottingham, UK. Thank you very much for your important presentation. Have there been many other studies of similar children, homeless children in other European countries? I know we published a paper in BMJ Paediatric Open about emergency department attendances for homeless children in Ireland, but I think it's good to sort of get the data at a national level, but also look on a European scale.
Yes, thank you. And there is also an European federation, which is FEANSA. I don't know if you know or if you have include the study in UK. I don't know, but it's. I know there is some few studies on different European countries, but I think it will be more interesting if we perform an European studies, in fact, because the children, as you mentioned, most of them are undocumented, and so they move from a country from another to another, and it will be more interesting to work at the European level, I think. So thank you for your remark.
Hi, thank you so much for this presentation. It's so important. My name is Logan. I'm a MD PhD student at the Harvard School of Public Health. And I was wondering if you had any thoughts about how we can more effectively get data, particularly longitudinal data on homeless youth. As you mentioned, there's so many issues of migration, and also there's big differences between chronic homelessness and perhaps one or two experiences and when they fall on the life course. And it's something that I just don't know how we would do well. And I was wondering if you had thoughts.
I don't know. I would like to know. I don't. In fact, I think it's a major issue. In fact, because they are still invisible in the public policy, because they are invisible in the statistic database, and they are invisible in the and so on, above all the children. So, yeah. If you are a PhD student, maybe you will have an idea to improve that.
I don't see any questions from the audience. I have perhaps one last question, because you mentioned several different factors that were impacting the different mental health and health conditions of both mothers and children. If you had to choose one factor to start working on as intervention-wise, which one would you say would be the most important to tackle first to improve their health and mental health?
Oh. I think I focus on mental health because I think it's very important in order to competency, the social and psychological competency of the children. I think if we can address mental health issue, maybe they can have the resource inside to go up. But in fact, it will be more efficient to work on the structural social, and so to work not in the health policy but with the housing policies. In fact, so.
Yeah,
it's
thank
a
you.
challenge.
There is enough to do. Yeah, thank you very much for your intervention.
Thank you.
Thank you.